Hi, my name's Sean Morton. I'm one of the senior lecturers in health and social care at the School of Health and Social Care at the University of Lincoln. I am also a nurse, and I've been nursing for 25 years, and now I currently teach nursing at the university. Recently I was asked to give a presentation on why there's a decline in men in nursing. And on looking at it, I realised there was a decline generally in people entering the nursing profession. So my lecture actually changed to 10 reasons to be a nurse and 5 more if you're a man. The focus right now as to why we've got a problem with nursing is I think a lot of the press we read is very negative about the NHS. We see numbers declining of people coming into nursing. I think 2017 saw a 25% decrease in people applying. And we also see people leaving the nursing register. So actually we are needing nurses right now. And with the negativity, I can understand why people probably don't want to come into it. So actually my session was to try and get people to see the good side of nursing. And there are things like the salary is not that bad, contrary to popular belief. It's up there with the average graduate salary. You've also got a job for life. So I think I've never been out of work with regard to my nursing career. I've been around, I've done different things, but you're not going to be out of work. Another thing that nursing I think is really, really positive, it gives you the opportunity to travel. I spent 8 years in America as a nurse and worked in a busy trauma centre. I then got my master's degree out there and went into healthcare management, and then came back to the UK and settled in Lincoln, and now I'm here back to teaching, which is what I really, really love. What I love about nursing is seeing people grow, people develop, people learn those skills, and then they start to apply those skills. And I think also I want people to see nursing as a good profession. It's not like it used to be historically, and actually it's advancing even more now. We're seeing changes in what nurses are being taught, changes in what nurses are actually doing, and we're seeing them elevating themselves to a level that probably they didn't have 20, 30 years ago. You can have a really good life. You can, your shift patterns can be very varied. Yes, you work nights, yes, you work weekends, yes, you work holidays. But actually, if you plan it right, you can have some significant time off as well. I think also the other thing about nursing is the public love us. The public love nurses. They love people in healthcare. And I think you have always got to respect, people always respect nurses. And I think it's a very, very admirable profession for you to consider and to get into.